Hygiene, the journey of health and dignity. Picture yourself walking into a bustling clinic in Nashville, Tennessee. The doctor glances at you. And within moments, they sense something's off, not from a lab report or an x-ray, but from subtle clues in how you care for yourself. It sounds far-fetched, but it's true. For older adults in America, personal hygiene isn't just about staying clean, it's a window into overall health. I recall my neighbor, Mrs. Evelyn, in Boise, Idaho, a vibrant woman who always kept her silver hair neatly styled. When she started skipping showers, we chalked it up to getting older. But a doctor's visit revealed her dry, flaky skin was an early sign of thyroid issues, teaching us that hygiene is far more than skin deep, it's a gateway to well-being. This article dives into 7 hygiene mistakes doctors often spot in older adults, seemingly minor oversights that can signal serious issues like heart disease, diabetes, or infections. Drawing from science, personal experiences, and stories across the U.S., I'll not only unpack these mistakes but also offer practical ways to address them. This isn't just for seniors, it's a call to action for families. From Seattle to Miami, to support loved ones in living healthier, more confident lives in a culture that celebrates independence and diversity. Mistake 1. Neglecting oral hygiene, a silent danger. Harvard Medical School warns that bacteria from gum disease can enter the bloodstream, tripling the risk of heart disease and stroke in older adults. Consider Sylvia, a retired teacher from Boston, Massachusetts, who dismissed bleeding gums as normal aging. The bacteria from her mouth triggered heart valve inflammation, nearly costing her life. New story. Meet Mr. Walter, a 72-year-old Vietnam veteran from Omaha, Nebraska. Walter prided himself on his self-reliance, a trait common in America's heartland. He hadn't seen a dentist in years, thinking his occasional toothaches were just part of getting old. At a local VFW meeting, his friend noticed Walter wincing while sipping coffee and urged him to get checked. The dentist found advanced gum disease, and further tests revealed early signs of cardiovascular issues linked to oral bacteria. Walter's wake-up call wasn't just about his teeth, it was about his heart. Analysis. Walter's story resonates with many older Americans, especially men who view dental visits as less urgent than other health concerns. In the U.S., where a single dental cleaning can cost $100 to $200, and Medicare often doesn't cover routine care, it's easy to see why folks like Walter skip the dentist. The American Dental Association notes that 60% of adults over 65 have gum disease. Yet many don't connect it to systemic health risks. I've seen this firsthand with my uncle in St. Louis, Missouri, who avoided dental checkups until a tooth infection landed him in the ER. It's not just about money, it's about cultural attitudes. America's obsession with perfect smiles, think Hollywood stars or toothpaste ads, can make seniors feel embarrassed about imperfect teeth, leading them to hide issues rather than seek help. But there's a deeper layer. Oral health ties to dignity. I recall helping my uncle choose a new toothbrush after his ordeal, and he admitted he'd stopped smiling in photos because of his teeth. That hit me hard. In a country where community events, from church potlucks to senior center dances, thrive on connection, a confident smile can be life-changing. Walter, too, found that addressing his oral health let him reconnect with buddies over coffee without pain or shame. Inspired by your interest in superfoods like almonds and quinoa for muscle health, I'd add that a nutrient-rich diet, high in protein and vitamins, supports gum health, reducing risks for folks like Walter. How to fix? Replace toothbrushes every 3 months. Worn bristles don't clean well. I suggest electric brushes like Oral-B, widely available at Walmart. For ease of use, brush correctly, 2 minutes, twice daily, with floss or interdental brushes. Set a timer, a habit many American households use. Regular dental visits. Programs like Donated Dental Services offer free care in states like Nebraska. Listen to your body. Bleeding gums or bad breath aren't normal. Keep a symptom journal for doctor visits. By prioritizing oral hygiene, older adults can protect their hearts and rediscover the joy of a confident smile at the next family barbecue. Mistake 2. Not showering enough. What does your skin tell? Mayo Clinic experts caution that infrequent bathing can mask signs of internal diseases. From diabetes to liver issues. Clarence, a former postal worker in Detroit, Michigan, thought weekly showers sufficed, but his discolored skin revealed early kidney disease. New story. Enter Mrs. Clara, a 78-year-old widow in Burlington, Vermont. Clara loved her cozy book club meetings but started declining invitations during winter. Citing the cold, her daughter noticed Clara's skin looked unusually pale and patchy during a visit. Worried, she booked a doctor's appointment, where tests showed anemia linked to poor nutrition, compounded by Clara's reduced bathing, which hid skin changes. After treatment and a new hygiene routine, Clara was back to debating novels with her friends. Her spark reignited. Analysis. Clara's reluctance to bathe regularly isn't uncommon, especially in colder U.S. regions like New England, where harsh winters make warm showers less appealing. The National Institute on Aging reports that 30% of seniors reduce bathing due to mobility issues or fear of falling. Yet many don't realize skin changes can signal deeper problems. I've seen this with a friend's aunt in Rochester, New York, who skipped showers because her bathroom felt too chilly. Her family only noticed when her skin developed sores, hinting at diabetes complications. In America, where skincare brands like Neutrogena dominate shelves, there's an unspoken pressure for flawless skin. Even in later years, this can make seniors like Clara self-conscious about dry or blemished skin, leading them to avoid bathing rather than address it. Yet, bathing isn't just hygiene, it's self-care. Clara's story reminds me of the pride Americans take in personal presentation. From church Sundays to farmers' markets, regular bathing, paired with moisturizing, could have helped Clara spot her anemia sooner. Drawing on your interest in nutrition, foods like salmon, rich in omega-3s, as you noted, can support skin health, keeping it supple and easier to monitor for issues. How to fix? Shower 3 to 4 times weekly. Use gentle soaps like Cetaphil. A drugstore staple. Moisturize post-shower. Lotions like Aveeno. With oatmeal. Soothe dry skin. Monitor skin changes. Take photos monthly. A tech-savvy habit in the U.S. Make bathing cozy. Portable heaters from Target make winter showers inviting. Regular bathing empowers seniors to stay active, whether browsing Vermont's bookstores or joining friends for coffee. Mistake 3. Neglecting nail care, hidden signals. The American Academy of Dermatology notes that nails reflect health, with changes like thickening or discoloration signaling over 20 conditions, including heart disease. Beatrice, 82, from Phoenix, Arizona, hid yellow, thick toenails, assuming they were age-related. A podiatrist found fungal infections tied to a weakened immune system, uncovering this serious condition. New story. Meet Mr. Henry, a retired carpenter in Savannah, Georgia. Henry loved morning walks along the Savannah River, but he stopped when foot pain made it unbearable. He'd ignored his brittle, discolored toenails, thinking they were just old feet. His granddaughter, a nursing student, insisted on a checkup. The podiatrist diagnosed nail psoriasis, linked to an autoimmune issue, and started treatment. Henry's back to his walks, now joking he's too spry to stay home. Analysis. Henry's oversight reflects a broader trend in America, where nail care is often seen as cosmetic, not medical, especially for men. The American Podiatric Medical Association says 75% of seniors have foot problems. Yet many delay care due to cost or embarrassment. I recall a friend's dad in Tulsa, Oklahoma, who hid his cracked nails until they caused infections, fearing judgment at the doctor's office. In a culture where nail salons thrive in every mall, seniors like Henry may feel out of place seeking professional care, assuming it's for younger folks or women. Nails, though, are more than aesthetics, they're health indicators. Henry's story shows how pride in independence, a hallmark of American culture, can backfire when it stops seniors from seeking help. His recovery, sparked by family intervention, highlights the role of loved ones in noticing subtle changes. Connecting to your interest in muscle health, I'd note that protein-rich foods like eggs, which you mentioned for sarcopenia, also strengthen nails, reducing brittleness. By caring for nails, seniors like Henry maintain mobility, crucial for enjoying Savannah's historic streets or local festivals. How to fix? Trim nails properly. Straight cuts prevent ingrown nails. Use clippers from Walgreens. Keep nails clean and dry. Dry between toes post-shower to avoid fungus. Watch for changes. Photograph nails monthly for comparison. See a podiatrist. Clinics like foot and ankle specialists offer affordable care. Nail care keeps seniors moving. From river walks to dancing at community events. Mistake 4. Mismanagement of incontinence, breaking the silence. Johns Hopkins Medicine reports over 50% of seniors face incontinence. But many hide it, risking skin infections or missing signs of cancers. Douglas, a retired accountant in Austin, Texas, used tissues for leaks, avoiding doctors. Painful sores later revealed prostate cancer. New story. Mrs. Lorraine, a 69-year-old choir director in Birmingham, Alabama, loved leading her church's gospel group. But she began missing rehearsals. Citing fatigue, her son noticed she avoided drinking water at family dinners and gently asked why. Lorraine admitted to incontinence, using makeshift pads to cope. A urologist visit uncovered a bladder infection and early kidney issues. Treatable with medication and proper products. Lorraine's back leading hymns, her voice stronger than ever. Analysis. Lorraine's silence is all too common in America, where independence can make admitting vulnerabilities feel like defeat. The National Association for Continence estimates 25 million Americans deal with incontinence. Yet stigma, especially in tight-knit communities like Birmingham's churches, keeps many quiet. I've seen this with a cousin's mom in Memphis, Tennessee, who skipped social events due to leaks, fearing embarrassment. In a country where drugstores stock endless products like Depend, access isn't the issue, it's the emotional hurdle. Lorraine's story underscores how cultural pride and self-reliance can clash with health needs. Her church community, a cornerstone of Southern life, could have been a support network if she'd opened up sooner. Family, as in Lorraine's case, often bridges that gap. Nutrition, like the yogurt you mentioned for gut health, can aid bladder function with its probiotics. Complementing medical solutions. Breaking the silence restores freedom. Lorraine's return to choir shows how small steps can revive big joys. How to fix? Talk to a doctor. Urologists at places like UAB Medicine are approachable. Use proper products. Depend or Poise pads. Found at CVS. Beat tissues. Maintain skin hygiene. Clean and dry after changes. Use barrier creams. Explore causes. Incontinence may signal treatable issues. Try pelvic exercises. Taught at community centers. Offer support. Phrases like, "We're in this together," ease tough talks. Proper management lets seniors shine, whether singing gospel or hosting game nights. Mistake 5. Incorrect ear hygiene, risks from familiar habits. ENT specialists warn that cotton swabs cause 40% of ear canal injuries in those over 65. Risking infections or hearing loss. Patricia, a retired librarian in San Francisco, California, punctured her eardrum with a swab, leading to infection and partial deafness. New story. Mr. Earl, a 74-year-old jazz enthusiast in New Orleans, Louisiana, cherished his weekly music gigs, but he started missing notes, blaming old ears. His wife noticed him digging at his ears with Q-tips and urged a doctor's visit. An ENT found impacted earwax causing hearing issues. Easily cleared. Earl's back jamming, his saxophone louder than ever. Analysis. Earl's habit reflects a common American reliance on cotton swabs. Marketed as household essentials, the American Academy of Otolaryngology says 90% of ear injuries in seniors involve improper cleaning. Yet drugstores sell Q-tips by the millions. I recall a friend's dad in Pittsburgh, Pennsylvania, who used swabs daily until an infection forced him to stop. In a music-rich city like New Orleans, hearing is lifeblood. Earl's story shows what's at stake. America's DIY culture encourages self-care. But with ears, it's risky. Seniors like Earl, proud of handling things themselves, may not realize swabs push wax deeper. Hearing loss isolates. Earl's gigs were his social lifeline. Family vigilance, like his wife's, is key. Nutrition-wise, omega-3s from fish, which you liked for inflammation, support ear health indirectly. Proper ear care keeps seniors tuned into life's rhythms. From jazz clubs to family chats, How to fix. Avoid small objects. Wipe outer ears with a damp cloth. Use safe drops. Debrox. Sold at Rite Aid. Softens wax. Regular ear checks. And clinics like Ochsner Health are accessible. Note symptoms. Ear pain or fullness needs attention. Clean ears mean staying connected. From Mardi Gras parades to quiet conversations. Mistake 6. Poor foot hygiene. Signs from your steps. The American Podiatric Medical Association states 85% of diabetes-related amputations are preventable with proper foot care. Raymond, 76, from Baltimore, Maryland, ignored cracked feet, thinking they were age-related. A doctor spotted diabetes signs, enabling timely lifestyle changes. New story. Ms. Gloria, a 71-year-old gardener in Asheville, North Carolina, spent hours tending her flower beds. When foot sores slowed her down, she blamed worn-out sneakers. Her neighbor, a retired nurse, saw Gloria limping and suggested a checkup. A podiatrist found neuropathy signs linked to undiagnosed diabetes. With treatment and foot care, Gloria's back planting roses, her garden thriving. Analysis. Gloria's neglect mirrors a trend. Many American seniors undervalue foot health. The CDC says 20% of seniors have untreated foot issues, often due to cost or lack of awareness. I've seen this with a friend's mom in Santa Fe, New Mexico, who ignored foot's neighborly nudge shows community's power in prompting care, ensuring seniors stay on the move. How to fix. Wash and dry daily. Focus on toe gaps to prevent fungus. Inspect feet. Use mirrors. Sold at Dollar General. Wear good shoes. Brands like Brooks support active seniors. Moisturize safely. Gold Bond Lotion. Avoiding toe crevices. Healthy feet keep seniors gardening, hiking, or strolling through town squares. Mistake 7. Hygiene issues related to medication. The signals that were overlooked. The American Geriatric Society notes 40% of serious drug side effects in seniors show first as hygiene changes. Barbara, 67, from Raleigh, North Carolina, was misjudged for body odor, but it was drug toxicity harming her liver. New story. Mr. Carl, a 70-year-old retiree in Boise, Idaho, enjoyed fishing trips with his grandsons. After starting a new heart medication, he noticed excessive sweating and a strange odor. Shrugging it off as, just me. His daughter, seeing him less engaged, pressed for a doctor's visit. Tests showed the drug was overloading his kidneys. Adjusted just in time. Carl's back casting lines, joking with the kids. Analysis. Carl's dismissal is typical. Many seniors overlook drug side effects, assuming they're age-related. The FDA reports 30% of seniors experience adverse drug reactions, often unnoticed until severe. I recall a friend's uncle in Orlando, Florida, who ignored dry mouth until it caused dental issues. Tied to his meds. America's complex healthcare system, with multiple prescriptions, heightens risks. In outdoorsy Boise, where fishing and hiking define retirement, staying healthy is key. Carl's case shows how pride in stoicism, a rugged American trait, can delay action. His daughter's persistence highlights family's role. Nutrition, like hydration from water-rich foods you mentioned, mitigates side effects like dry mouth. Noticing changes early keeps seniors like Carl active. From lakesides to family picnics. How to fix. Track hygiene changes. Log symptoms in a notebook or app. Stay hydrated. Use reusable bottles. A U.S. trend. Talk to doctors. Pharmacists at Walgreens can advise. Don't adjust meds alone. Always consult professionals. Monitoring drugs ensures seniors enjoy retirement's adventures. A worthwhile journey. These 7 hygiene mistakes are warnings, but also opportunities for older Americans to thrive. From Omaha's VFW halls to Asheville's gardens, small changes, like a new toothbrush or a foot check, build healthier, happier lives. I urge you to act today. Notice a loved one's habits. Start a conversation, and celebrate the dignity of care. In America's diverse tapestry, every step toward hygiene is a step toward connection and joy.